Coronavirus has changed all of our lives, but how will it impact our future? Does this change everything? I'm Janelle Simplinsky. On this episode of Does This Change Everything? The digitalization of healthcare. Will the corona pandemic speed up the digitalization of healthcare? Will it change healthcare services in the future? How will these changes be financed? We'll find out more from Marcin Golec, a medical doctor and health economist at the European Investment Bank. Does the coronavirus change the future of health services? If so, how and why?
Well, coronavirus pandemics is a generational experience globally, and especially in the health sector. Will it change the health sector? I think it will accelerate, I hope tremendously accelerate, the changes which were already behind the corner before this unfortunate and dramatic pandemics happened. This means digitalization of the health sectors, so using all this potential of digital technologies which have been introduced in sectors, but the health sector was lagging behind this development. And the second change, which will be linked with digitalization, is acceleration of medical research and especially acceleration of implementation of medical research results into practice.
Can you explain a little bit more? How can we put medical research into practice?
I think we all observe now that big supercomputers are now working on analyzing data, clinical data and molecules, trying to, as fast as possible, develop new drugs for coronavirus, develop vaccines. So firstly, this computational power linked with data, this will accelerate application of medical research. And the second thing is that if we have a health sector ecosystem in which patients is more monitored, followed by health telemedicine environment, then it will be safer to introduce certain new drugs, new therapies, new diagnostics.
Can you talk a little bit about the new approaches or products that might be needed to cope with the future?
Well, I think not only hospitals as such, but also about the whole health sectors. So digitalization across the health sector, electronic health records, which may be used in hospitals, but also across other health sector facilities, introducing of practice-based medicine, so possibility of medical doctors from a hospital to analyze their patients' data and application some conclusions immediately. So using the knowledge of patients of today to treat the patients which will come next week. Then there are tools which enable to follow the patient's health status once they leave a hospital or healthcare facility. Telemedicine, mHealth. Now we observe, for example, application of quarantine apps, which enable to follow patient or individuals while they are in quarantine, but they also may be used to follow their health status and provide them first medical advice. The next thing is that we all observe that, for example, hotlines, medical hotlines are now overloaded if we use, like in some countries, voice bots to address, to answer individuals calling, and only in complex cases to pass it to medical professionals.
How difficult do you think it will be for the health sector to be able to use these new technologies? What have you seen so far in the crisis that gives you hope or makes you realize how far behind we are?
I think, I'm afraid, the latter one, but it is not surprising. As I said, all changes which are being introduced in the health sector are complex and risky, and we have to approach them very carefully. The digitalization of the health sector is a very complex process which needs huge multi-billion investments, but it needs also time. It will not happen during 1 month or 1 year. It needs also tremendous human capital. It needs different skill mix of medical professionals. It needs legal changes. It needs society readiness, engaging in the health sector, different type of professionals, for example, more IT engineers, mathematicians, data analysts. The ecosystem of the health sector will change.
Will the digitalization of healthcare raise concerns like privacy? Will it be difficult for people to accept these sorts of changes?
Well, so obviously, medical data are very personal and very confidential. They have to be protected. So definitely, this is one of the main challenges in cybersecurity of medical data, especially if the digitalization is across health sector. And that is why I think that there is a need of presence of different professionals like IT engineers, who will ensure the security of the data, but also it will also require new regulations. That's why we need lawyers who will implement this new or create and implement these new regulations so the patient's data, our data, are safe, and we will be confident that this new health sector, digitalized health sector, will act for our good.
Will this change how people receive their medical care?
So imagine that 50 years ago, our doctors did not have basically any sort of medical imaging except X-ray. They were blind. They could not, in some sense, they could not look into our bodies. Now they have CT, MRI, they have PET. They can look inside all this digital imaging and medical imaging. They can look inside our bodies. 50 years ago, they couldn't. And I think we can compare this digitalization of the health sector to the same situation. The medical doctors will have an insight into our data, and our treatment diagnostic processes will be much more safer, much faster, much better, much more accurate, personalized. Our doctors will be able to address our health problems, much better than now. This applies to the situations like pandemics, where we already see in some countries like Taiwan, when this digitalization was used effectively, that the scale of pandemics have been narrowed down. But this will also apply these benefits to such diseases like cancers or other non-communicable diseases, different types of chronic diseases like diabetes, like cardiovascular diseases, COPD, etc.
What's the EIB's role in all of this? How do we promote these kinds of changes and new technologies?
The EIB have been always keen on supporting digitalization of the health sector with the legal frameworks, of course. We were always enthusiastically supporting technological and non-technological innovations in the health sector. When we look now during this pandemic at our health sectors, we can clearly see that there are huge investment gaps in the health sector, and the EIB will try to address them. Now, what EIB can do in that regard, we can be with our promoters, with our clients from the preliminary phase of designing digitalization and of the health sector. We can provide appropriately tailored long-term financing. And we have to remember that digitalization and medical research means multi-billion investments. We have to also remember that the EIB is an international finance institution which, on contrary to all others, like the World Bank, operates in very high income and high income countries. This creates opportunity for us to finance top-notch developments in medical research, but this also creates certain obligation because, as we know, according to WHO, rich countries or high-income countries have 45 times more medical researchers than poor countries. So if there is some development and hope, for example, in fighting with COVID-19, this lays on our shoulders, and we have to try to provide this.
Thank you, Marcin Golec, healthcare economist at the European Investment Bank. This is Does This Change Everything from the European Investment Bank, the EU Bank.